Assalamu alaikum. My name is Hafiz Munib Said and today I am going to present Alzheimer's disease. So first of all, what is Alzheimer's disease? So Alzheimer's disease is the most common type of dementia. Dementia is also known as memory loss. So it is a progressive disease which begin with the mild memory loss and possibly lead to the loss of ability to carry on a conversation and to respond to an environment. So it usually involves the part of brain which control thought, memory and language. Here is a video for the reference of
We all
Alzheimer's
face
disease
the
or
ravages
the
of
introduction
time.
of Alzheimer's disease. Moving on next is the epidemiology of the Alzheimer's disease. So what is epidemiology? Actually, epidemiology is a branch of medicine which deal with the incidence, distribution, or possible control of disease and other factors relating to health. So epidemiology of Alzheimer's disease. So worldwide, the global prevalence of dementia was estimated to be 3.9% in people aged 60 plus years. So here are some regions in which Alzheimer's disease distribute. That is Pacific regions, Latin America, China, and Africa. So actually the prevalence or distribution of the Alzheimer's disease is widely spread on worldwide, and it also double itself every 20 years. Incidence. The pooled incidence rate of Alzheimer's disease, that is AD, among 65 plus years of age people in Europe was 19.4 persons per 1000 persons, and the pooled data from two largest scale community based studies of people aged 65 plus years in the US Seattle and Baltimore areas yielded an incident rate of AD of 15 male 13 and female 16.9, that is the average 15. And the incidence of the Alzheimer's disease is up to 85 years of age. So age specific incidence of Alzheimer's disease is per thousand persons years. So however, it remains uncertain whether the incidence continues to increase even at the more advanced age or reach a higher level or plateau at a certain age. This is relevant for projecting the burden of the disease as well as for understanding its etiology. But there are some notions that it depends upon a certain factors, environmental factors or genetic factors, and that leads to a conclusion that after a certain point of age the Alzheimer's disease incidence tend to decline in the older people. Then the impact of Alzheimer's disease at an individual level and societal level. At individual level, it significantly shorten life expectancy, it causes physical disability, it causes the institutionalization, which is also known as hospitalization, and decreased quality of life. And at the society level, it causes tremendous consequence for our society and economy, as it is related to dementia, and our most manpower or company power is based upon still persons, and which may cause many complications. Then the determinants of Alzheimer's disease. So Alzheimer's disease or dementia is a multifactorial disease in which older age is the strongest risk factor. That is, in old people it is more relevantly exposed. Interventions towards Alzheimer's disease. Current evidence tend to support the notion that dementia onset may be postponed by implementing interventions towards the potential etiological factors. That includes both the risk factors and protective factors, and which we also known as the primary prevention. And there is the early detection. If we detect the Alzheimer's disease at an early stage, then we actually prevent it, and this is also known as the secondary prevention. And whereas appropriate care of the patient and pharmacotherapy of the patient is comes in the tertiary prevention. Then moving forward to the risk factors or causes of the Alzheimer's disease. First of all, there are some building up of the proteins. So here are in our brain cells there are some proteins which we known as the amyloid protein. So these proteins in Alzheimer disease make some plaques or make some clumps or fuses together or coagulate together around the brain cells, and they cause the synapses to lose and eventually neuronal death. So which eventually leads to the memory loss. So it is also a cause of Alzheimer's disease. Then there is also a decrease in chemical messengers, obviously due to the neuronal death, and there are very decline number of the acetylcholine in the brain of people with Alzheimer's disease. And there are certain areas of brain which usually shrinks, like hippocampus and temporal lobe, etc., during the Alzheimer's disease. Then the second factor is the age. So as I earlier said, age is the most single significant factor in the incidence of the Alzheimer's disease. So it usually doubles after the age of 65, after every 5 years. And the third one is the family history. So family history usually belongs to the genes. So the genes you inherit from your parents can contribute to your risk of developing Alzheimer's disease, although its risk is very small, but in few families its risk is very high. The fourth one is the Down syndrome. So the people with the Down syndrome can also lead to the Alzheimer's disease. And here is some notion that during the Down syndrome actually leads to the some complications around the genes. So it leads to the amyloid plaques around the brain cells, and which eventually leads to the Alzheimer's disease. Fifth one is the head injury. It is also said that due to head injury you also lose memory, but there is more research in area, so we have to do research in that. There is no particular mechanism from which we can say that head injury lead to the Alzheimer's disease. The sixth one is the cardiovascular disease. So the patients with a lifestyle factors and conditions associated with the cardiovascular disease also lead to the Alzheimer's disease. The lifestyle factors which are associated with the cardiovascular disease are smoking, obesity, diabetes, high blood pressure, and high cholesterol. So if people quit smoking, or you make their habit exercise, so they can prevent to some extent the Alzheimer's disease or dementia. And there are some other risk factors. So these includes hearing loss, a sedentary lifestyle, loneliness, or social isolation, or untreated depression. So these risk factors are actually not very far or not very prominent effect on the Alzheimer's disease, but they also in consideration. So moving forward is we have the pathophysiology of the Alzheimer's disease. So what is pathophysiology? Pathophysiology is actually the disordered physiological processes associated with the disease or injury. So in Alzheimer's disease there are two kind of distorted physiological processes. First is the extracellular beta amyloid deposits that I said earlier, and the second is the intracellular neurofibrillary tangles, that is we also known as the TNFs. So first is the beta amyloid deposition, and the second is the neurofibrillary tangles. So both these conditions or both these disordered physiological processes leads to the loss of synapses and neurons, which actually results in the dementia and Alzheimer's disease. And then there are the mechanism of the beta amyloid peptide protein and neurofibrillary tangles, which damage our neurons, but it is not completely understood. But here are some theories which we can through which we can explain the pathophysiology of the Alzheimer's disease. First of all is the amyloid hypothesis. So in amyloid hypothesis, it is supposed, or it is described, that the progressive accumulation of the beta amyloid protein around the brain cells causes the synapses to close and eventually leading to the neuronal cell death, and that is particularly in the area which is concerned with the memory making. So it causes the dementia. The second one is the sustained immune response and inflammation. Sometimes it is seen that the brain parts inflamed a bit, due to which it causes a pathological factor for the Alzheimer's disease. Moving forward to the last mechanism, which is the prion mechanism. So our brain has some proteins which eventually, due to any uncertain factor misfold into a pathogen like structure which we know as the prion. So this prion actually stimulates the other proteins to make or self replicate just like the prions, and then these prions help in the neurofibrillary tangles and amyloid and tau protein deposits. Tau is also a protein present in our brain. Moving forward to the pathology of the Alzheimer disease. Pathology is actually the total study of disease, or which we call which we can say that cause and effect of the disease. So pathology of Alzheimer disease. So pathology of Alzheimer disease includes generalized cortical atrophy, typically most prominent in the medial temporal lobe and hippocampus. So in hippocampus and temporal lobe there is cortical atrophy in Alzheimer's disease. Microscopically, we can say that there are amyloid plaques and there are the neurofibrillary tangles that are NFTs that are going to happen during the Alzheimer's disease, and those cause the dementia. And here is the reference of the amyloid plaque, and as we can see in this picture that here from left to the center there are some amyloid plaque, and this amyloid plaque leads to the Alzheimer's disease. Next we have the NFT or neurofibrillary tangle. So neurofibrillary tangle is actually a distribution and density of NFT appear to correlate with the clinical presentation. So it is a magnified view of neurofibrillary tangle. Here is in the black color. So now we move forward to the treatment of the Alzheimer's disease. So first of all, in current situation we use two types of drugs for the treatment of Alzheimer's disease. First of one is the cholinesterase inhibitor, and the second one is the NMDA receptor antagonist. But here we have a new treatment, and we have a very recently FDA approved drug which we also known as the Aducanumab. Aducanumab is comes in brand name of the Aduhelm, and it actually prevent the accumulation or coagulation of the amyloid protein and prevent its deposits. So if the deposit does not form, then Alzheimer's disease could be cured. So it could be very beneficial to the patients which suffer from the Alzheimer's disease, and it would be the first drug to come in the market which found to reduce the clinical decline of the Alzheimer's disease, because the current drugs or the previous drugs are actually treating just the symptomatic treatment of the Alzheimer's disease. And the second or third new treatment we have is actually some proposed treatment which we known as the active immunotherapy and the passive immunotherapy. So here are two approaches. In active immunotherapy, it involves the administration of antigen in order to stimulate the activation of release of antibodies, and in passive immunotherapy, it is based on the use of antibodies directed to the C terminus, N terminus, as well as the mid domain of the amyloid beta peptide of the amyloid protein. Here are some references for the Alzheimer's disease. So that's all for the Alzheimer's disease.